Next, I'm excited to introduce Dr. Hani Stoklosa, who's the founding CEO of HEAL Trafficking and an emergency physician at Brigham and Women's Hospital with appointments at Harvard Medical School and the Harvard Humanitarian Initiative. Dr. Stoklosa is an internationally recognized expert, advocate, researcher, and speaker on the well-being of trafficking survivors in the US and internationally using a public health lens. She published the first textbook addressing the public health response to trafficking, entitled Human Trafficking is a Public Health Issue, the Paradigm Expansion in the United States. She has a powerful and unique view on the impact of the COVID-19 pandemic on trafficking victims and survivors and communities experience vulnerabilities. Dr. Stoklosa, over to you.
Thank you so much, Catherine. As an ER doctor who also runs an anti-trafficking organization, this past year has underscored so clearly the need for the United States to approach trafficking as a public health crisis. From the front lines of the ER, I have seen firsthand how pressure cooker home environments and lost jobs have led to unprecedented rates of homelessness, substance use, food insecurity, which directly increase trafficking. In the ER the other day, after evaluating an elderly patient with dementia, I noticed how the home health aide who accompanied my patient looked so tired. And after talking with him privately, I learned that this home health aide has always worked long hours, but when COVID started, things changed. His boss confiscated his passport and threatened that bad things would happen to him and his family if he tried to leave. Unfortunately, there are so many more trafficking patient stories that I could share from this past year, including those patients who had left their traffickers and returned them in order to have a roof over their heads, simply to eat. This increased vulnerability to being re-trafficked due to economic reasons was echoed in a recent survey where 76% of US survivors of trafficking reported that their financial status had become much worse as a result of COVID. Now, more than ever, we need to take a public health approach to trafficking. Think about it. Just as we know we cannot arrest or prosecute our way out of childhood obesity, HIV/AIDS, or the opioid epidemic, we cannot arrest or prosecute our way out of trafficking. A public health approach is holistic, it's whole of government, and it's across all the P's: prevention, protection, and prosecution, with specific resources directed to prevention and protection based on what survivors of trafficking say they need, and address the root causes that render people susceptible to trafficking. Key public health recommendations that we're making today include ensuring services in the child welfare system are extended to children in forced labor, addressing the nexus between human trafficking and gender-based violence, and providing whistleblower protection for trafficking survivors reporting forced labor, which will help people like my patient's home health aide. Without attention to root causes and sufficient funding to address them effectively, there will always be vulnerable groups and people able to exploit them. A public health approach is the only way to catalyze an end to trafficking. Thank you.